Hey, and welcome back. In this episode of the Kinky Wellness Podcast, we welcome Jennifer Sharp. Jennifer is a passionate postpartum and pelvic floor specialist who is truly dedicated to helping women reclaim their bodies and strength. Fun fact about Jennifer, she helped me take my first cold plunge ever. But today, she is here to discuss the hot topic of C-sections. Having had this experience herself, Jennifer is ready to break it all down and share her expert insights, from common misconceptions to statistics that might be a cause for concern and everything in between. Jen is an absolute amazing soul. So without further ado, let's welcome Jennifer to the show. Hello, Jen, and welcome to the show. How are you doing today?
I'm great. How are you?
I'm doing great. I'm excited to have you on the show because today we're going to be discussing C-sections and what that means and kind of just misconceptions of it. But I want to begin with a little bit about you and your story and if this brought you into your profession when it comes to C-sections.
Yeah, that's a great question. So it in a roundabout way actually did. So I had my first C-section 12 years ago this week, actually. So she's just turned 12, which is amazing. But when I had my C-section, I actually didn't realize the complications that I was having were linked to that until two more babies were born. And I started to kind of unravel what symptoms I was having. And got myself checked into a pelvic floor PT, and I realized, yeah, okay, some things have happened with this C-section that people don't talk enough about. And so that really sparked that curiosity and that drive to really support other women that are probably going through the same thing. Because I kept hearing this so often in my fitness coaching career where women would have all the same symptoms as me. And I'm like, well, it's just because we're moms, but it really wasn't. I started to do a little bit more research and understanding of what was happening to our bodies after we had babies. And what I found really changed my life. And then I was able to change the lives of my clients because of this. Because what I realize is in the fitness industry, we're kind of sold this bounce back culture vibe, right? And they do a really great job of marketing it. It's beautiful and wonderful. It gets us to buy all the things, but it's really leaving women at a disadvantage in our bodies, and we're not getting the healing and support that we actually need. And that's where I come in now as a corrective exercise specialist and kind of bridge that gap between fitness and the medical world, where we can kind of meet in the middle and figure out, okay, why are we having these symptoms? What is the root cause? And how do we get you from feeling the way that we do to feeling the way that we want to, and maybe the way that we once did? In my case, what was happening is my scar tissue had adhered to the inner vaginal wall, not the inner, the outer vaginal wall, I should say. And it was causing so much pain for me with intimacy. It was a nightmare. For almost a decade, I lived like this and didn't realize that there's something that can be done for this. It was really the bladder leaks that prompted me to get into this. And that was after baby number two. And so once I kind of unraveled the bladder leaks and kind of backtracked through my whole history, I was like, well, these are probably all things that stem from that scar tissue that's just all over the place in there that has never been worked on. It's never been checked out. It looked great from the outside. So I thought there was no problems there.
Well, that's interesting. And thank you for sharing your story. It's interesting about the fact that we can look at it and we think, oh, it's just, on the outside looks good. But no, there's so much that's going in on the inside. And that's, I think we don't get that information as we're leaving. I think they're very much like, oh, it looks good. You can go now.
There's no infection. There's, nothing to visually see. It is what it is. Live your life.
Now, when it comes to C-sections, I really feel like there's a lot to unpack here because I have done some research where it seems like we are doing C-sections at a really high rate. I was looking at some facts. It says last year in 2023, Canadians did about 32.5, but the WHO says that it should be in the 10 to 15% rate. So we have crazy numbers, I feel, when it comes to this. And I feel like from a little bit of what I've researched, some of it is not necessary. It seems like it's the more we go down. I'm not saying that it isn't necessary in some cases, for sure, we still need it, but there's a lot of ways where it's like it might not be needed to do that.
Yeah, absolutely. I'll give you my case as an example. Mine was a scheduled C-section because my daughter was breech, and I didn't question it at all. I just took it for face value, what my doctor said to be true, and I went along with all of it. But in reality, we should be asking more questions, really. I should have asked more questions. I was very young and naive, and I didn't. I just assumed that that was the best route. She knew what was best, no questions asked. But there's the opportunity to help turn the baby if that's safe to do so, or you can deliver a breech baby. There is some obvious complications that could happen, but there's complications with all three of the methodologies that are presented to you. You know, C-sections carry complications, breech birth carries complications, turning a baby carries complications. So I think it's a matter of weighing out what is best for you and your family and your body.
Absolutely. And to add to your point, there's one other thing that I saw that I used to take at face value was I have seen cases with the umbilical cord tied around the baby's head, but I was researching that and it says that 1 in 3 babies can have that. So it's totally normal, I guess you can say, almost on a playing field. Like 1 in 3 babies might have that. And so there's not this like, oh my gosh, we have to get a C-section because this could hurt your baby. And so that I feel like going deeper into that before taking it as face value and then learning more about it, that's actually okay. Like it doesn't necessarily mean automatically that something's in danger.
Right. Right. It's a matter of monitoring it. And they're monitoring your baby when you're in labor anyways. If you're at the hospital, and even if you aren't, they're monitoring it. They're understanding what's happening and very cautious. So I think, yeah, like you said, it's almost normal. Like 33% of babies have it wrapped around their neck, like you said, and it's just another kind of thing that we watch for in birth.
Hmm. Now, when it comes to C-sections, do you feel that there's a lot of misinformation around even prepping for it and healing for it that we need to address?
Absolutely. Some of the misconceptions, the big one for me, and that I get asked a lot is, once you have one C-section, do you have to continue down that path? And the answer is no. And that always surprises people because I think at one point in time, we were told that if you have that C-section, every subsequent pregnancy will result in a C-section, which is just not the case anymore. We take it on a case by case basis. And of course, usually they give you the option. So I had the option to have a repeat C-section for my second and third children, which I almost went that route, but my doctor was actually really wonderful. And he was like, I'm going to let you think it over. But he was really great about empowering me and giving me the actual information to go ahead with the VBAC, so a vaginal birth after C-section. Yeah, I think it comes down to your care practitioner, and mine was excellent because I would have had the repeat C-section had he not explained it as best as he did to me. So that's a huge one, and I think that that's wild that we still think that in this day that that's the case. And then another thing I really loved learning about was you were talking about like exercise and movement and prep, that really after you have that surgery, it's best for you to start moving as soon as possible. It's really, we talk about, laying in bed and being still and taking it easy, and you should do those things. I'm not saying to get up and go for a run or anything crazy, but there's so much that we can do to help our body heal, just even from your bed, just breathing exercises, really gentle exercises, just some heel slides on the bed. Stuff like that really helps us reconnect our mind muscle connectivity to those lower abs and really helps improve your healing. It helps bring sensation back into that area after we've had this trauma and this big scar. So it's really vital almost that we do get moving, get that area kind of reconnected as soon as possible.
And thank you for sharing about the C-sections after you have one, because that was actually one of my follow-up questions, if that was something, because as far as until now you came onto the show, yeah, that's what I thought too. So it's quite big. Like there's quite a lot. And Do you feel that it's just an outdated health system what we're working with, or where is the disconnect here before the information gets passed down?
There's a little bit of that where we see like some of our older doctors, they're a little bit more outdated, but I'm seeing this kind of shift happen right now, which is really welcome and wonderful into more updated knowledge base being presented to patients. And even like I said, like my OB was wonderful and he really was the catalyst for me to not have that repeat C-section. And a lot of OBs at that time probably would not have gone that route, but he's younger and he's probably more up to date, I would maybe say, than some that are just, just doing the same routine that they've always done.
Hmm. Well, when it comes to C-sections and the fact that the WHO says that the ideal rate is 10 to 15 and we're doing this at 32%, why do you think that there's such an increase here?
Oh yeah. I think it's twofold. So I think it's kind of our lifestyle base. So a lot of women fear labor, pain, delivery, so they'll opt for a C-section. And then there's the misconception that it's going to somehow save their pelvic floor. There's a lot of worries about their sexual well-being postpartum. If they have a vaginal birth, maybe their partner will view them differently. So there's that kind of a mentality that happens. And then on the other side of it is the medical side. We are seeing higher rates of obesity. So that is more leaning towards we're going to need some medical intervention to get that baby out. If they have gestational diabetes or any sort of heart issues going on, we want to have a C section. So it kind of correlates with the increase in North America, and especially our health, really, our overall health and well being. So obesity rates kind of tie into that same, they parallel one another. And then, of course, there's the OBs that we have an increasing maternal age. So they're pushing these older moms to have C-sections. So because we're not in great health when we're a little bit older, apparently. Even though we can be,
Mhm.
it's just, yeah, it's again a misconception, right?
Heard that, when the doctors get close to the end of shift or wants to go on vacation or something, like I've heard that people have been almost pressured to have a C-section and they kind of need to stand up for themselves in these situations. I've seen it on these forums. And I'm wondering if you have any advice.
Yeah, absolutely. I think, again, it comes down to being open and honest with your care practitioner. It's really challenging, I'm sure you know, here in Canada to maybe get a second opinion, especially in obstetrics. It's really hard to get an OB as it is. So to get a second opinion, especially late term, it's really challenging.
Mm,
Although I would love to say get one, it's not always available. But I also want to say that you know your body best and you have that intuition that your body is not ready to just go into a C-section right now. Maybe it's just not ready for labor and that's okay. And I think that advocacy is really important and understanding why the doctor might be wanting you to have a C-section. Just relaying back to my case, she was breech, so I knew that it was a scheduled C-section. So something like that might be a great reason why you would, but having that open dialogue with your care practitioner is of utmost importance. Another great tip I would have is when they tell you this, if they're telling you this in an appointment, is go home, digest that information, and then on your next appointment, come back with a list of questions. Why is this happening? What are my risk factors? What are some of the tips and things that I would need to know to better prepare myself for maybe this or understand why this is happening to me so I can move forward or advocate differently for myself.
Now, when you have a scheduled C-section, what are the steps that you should do to prep for it? Is there a time frame that you should prep for it? And what would those be?
I think no matter what, in pregnancy, we should be preparing our bodies for birth, whatever that birth is going to look like. And that's just keep moving through your pregnancy, working on activating those core muscles, pelvic floor muscles. And then once you're getting closer to the end, like 32 to 34 weeks gestation, I would start to kind of work on releasing those pelvic floor muscles. And that's going to help you pass baby through so the uterus can do its job of pushing that baby out. Even again, even if you end up having a C section, this might actually help prevent that C section if we can help those muscles of the pelvic floor kind of relax and open up. Yeah. And then your healing afterwards is also an easier time if you've kind of kept up with those things throughout your pregnancy.
Is there things you can do to prevent a C-section? Like exercise, it really just comes down to getting the body fit, or is there other types of things you can do?
I don't know that you could necessarily prevent it. I mean, if you were in an emergency situation, it's usually
Mhm.
because there's something going on with the baby, they're the fetal distress and they just want the baby out, or maybe you're in distress and they have to get the baby out. Those are the two reasons, usually for an emergency. But scheduled C-sections, yeah, it's a little different.
Mm. And afterwards, it is important to move. And I feel like when it comes to healing in general in the body, there seems to be this narrative of just, don't move. And so I think that that is, you can take it in the C-section of what we're talking about, but really bring that into all types of avenues of your life is really just the importance of moving and not sitting still.
Yes, absolutely. I think there's a rule that I really love that I heard. It's like the 5 days on the bed after you've had a baby, no matter what, whether it was surgery or vaginal, 5 days on the bed, 5 days around the bed, and then just 5 days in home. So it's about 15 days total that you're just kind of like staying in your little bubble. But even when you're doing the 5 days on the bed, there's things that we can do to get that area moving that aren't standing up and taking a walk down the street and things like that, that your body's probably not quite ready for. And again, it's breathing exercises, it's gentle movements and activation of these lower abdominal muscles, the deep core muscles, the pelvic floor muscles, all of those things, just to help them kind of bring some blood flow into that area. It helps healing and really help just stimulate the nerves and stimulate that area so that we are healing better and just making sure it's moving so that it's not stagnant.
Now, when it comes to this, is there long term health implications for the babies and mothers that we need to be aware of that are born via C section?
Yes, absolutely. So there is some implications. So future fertility is a big one. The scar tissue that forms can form adhesions, like I was sharing about my story in that internal area. So this could possibly affect your fallopian tubes or your uterus and make passing an egg more difficult. So you can see things like that come up, and uterine scarring. This can it affect the implantation when you do get pregnant next time. So you might notice that it's harder for you to get pregnant because that baby just can't implant, even though the egg is fertilized. And then other complications post, if you had one C section, it's more of an increased risk of stillbirth in your next one. It's about a 23% increase in stillbirth, which I found really shocking when I read that. I had to read that 3 or 4 times because I couldn't believe that that was the case. But it's yeah.
It's I'm sorry, but that's wild. I did not know that C-sections affect your potential to get pregnant in the future. I feel like that's a huge thing that they don't really share. And that's shocking. Wow. I'm shocked, but yet again, when it comes to the medical industry, not shocked in the same breath, but that's pretty big numbers.
Yeah, it's a little scary actually, and especially when we're making this such an elective process, especially with the fear of birth, when we could be doing so much to empower women through birth. Like our bodies are designed for this, and it's a shame that we fear what our bodies can do.
No, I feel you on that because that was actually something that I was fearful for. And I feel like that's how my health system taught me. We saw these like gruesome, crazy birthing videos where everyone's screaming and it's just traumatic. But then I started watching at home natural births and births in water and things like that. And they were so calm and they were able to give you how to handle the pain. And there's things that you can do. And it doesn't have to be this very scary moment. But yes, I definitely feel that the fear of birth is definitely putting into these high numbers that we're seeing over here.
Absolutely. Absolutely. We fear that pain. We fear going through the process of it for sure. I know I did. And that's why I wanted the repeat C section. And then once I realized having that, not a C section, I was like, wow, this is actually pretty great
Well, another thing that
considering.
I know that I was learning about C-sections, I was reading a Trauma and Memory by Peter Levine, and he was saying that there was a baby that was born via C-section, and he didn't get that natural bonding right after, and so there's this really big importance of people that have C-sections really do have to put a little bit, I guess, extra effort in making sure that you do have that connection, and that was some of the education that I was learning through him and his body work.
Yeah. It's pretty wild because, okay, so when babies are born via C section, we see higher rates of respiratory issues because when a baby should be passing through the vaginal canal, there's a lot more pressure, and that helps pass all of the fluids that are in our lungs before we're born. So when we have a C section, it's actually not going through that pressure. So they don't get to clear all that fluid out of them. So they have higher incidences of these issues. And then there's the immune system development. So their gut microbiome is kind of off. Again, the same thing because you're not passing through the vaginal canal and getting that bacteria and all those things that we need. And then, of course, like you mentioned, the bonding that was a really big one for me. I struggled with breastfeeding because I think you're in a trauma space when you had this surgery. It was very hard on my body. I just couldn't hold my daughter. There was one point I just remember I knew I was going to be sick and I don't even remember passing her off. It felt like I threw her. And then I just was so out of it. I couldn't hold her for a long time and it was really challenging. And they want you, like my other two children obviously were born vaginally. So as soon as they're born, they're put right on you. That skin to skin contact is so vital in those early hours. And just making
Mm.
sure if you are breastfeeding that they're immediately getting latched on. And that isn't as easy because your body takes longer to think, oh, the baby's born now because you've had this surgery to remove the baby rather than your body processing all of the natural processes that it goes through. You still have the post-birth contractions, but even that is very different than if you had a vaginal birth. It's a little bit more delayed. There's a little bit more to it because your muscles, going back to the pelvic floor muscles, they weren't lengthened out like they should have been to pass a baby. So now you're having this other complication that we haven't even touched on yet. But when you contract after birth to heal, your body knows to do that, whether you've had a vaginal or a C section. So, what we see in C section women is a very tight pelvic floor because we've contracted, but we've never expanded in the first place. So, there's that complication that comes up too.
Interesting. So there's a lot of these natural processes that we need to still be considerate because again, what you mentioned, and I agree that our bodies are designed for this. So when we interrupt at some stage for whatever reason, we still need to acknowledge that there's other processes that either need to complete those cycles or at least pay attention to them. They might come up later. And even with the babies being able to push that pressure of the fluid out of their lungs, I didn't know that either. So is there other types of things that we should be aware of when it comes to C-section births as well for the mother or for the baby?
Yeah, of course. So we see a higher NICU admissions when we have C sections, especially in elective surgeries, because labor hasn't begun. So our body does not have that process started. It's done for us. So we see, yeah, they just need more, well, attention to their respiration and some transitional issues that come up. So we see much higher rates there. And then, of course, metabolic concerns. So there's some evidence that has come out that suggests that C-sections actually result in higher obesity rates and type 1 diabetes happening earlier in children, which I found really fascinating too. And again, linking that back to that gut microbiome that we kind of miss out on through the vaginal birth.
Everything there's the gut is so important, isn't it? I feel like a lot of illnesses come from the gut, a lot of healing, the gut bio, like that's so interesting to me. I'm definitely going to follow up with that because type 1 diabetes and obesity, we're already struggling with rates. And, if there is a correlation to this that extends past just like what we're eating, then that's definitely something that people need to be aware of.
Absolutely, absolutely. I wish I had known this much sooner. And it's funny, knowing this now and just knowing my oldest daughter, this is very true for her. She really struggles with um, food and nutrition and like textures and things like that. And I have to wonder, is this something that's stemming from that gut of hers and emotional regulation? I mean, our gut is our second brain, right? So it's when there's something off in your gut, it does affect your emotional health as well. So she does
Mhm.
struggle there, and it's been a journey to kind of unravel that with her.
Wow, that's so interesting. Now, after the C-section, though, it comes to healing, and we have our scar. Now, is there a typical time frame of when that heals, or is that different depending on each person? And how do you really take care of your scar afterwards?
There's some degrees of variability, but I would say by about 18 months, you're fully healed. It's not as quick as it looks on the outside. There's a lot of deep layers that have to get healed. That's why when you have a C-section, they generally want you to wait about 18 months to 2 years before having your next one, just so that all that scar tissue is done doing its thing. It's settled. It's where it's supposed to be or going to be. Um, yeah, that's really important. And then just within the first 6 months is when they say is the best time to start C-section scar massage. You'll get the most impact out of it. But what I do know, because I didn't start that until almost a decade after I had mine, is it's never too late. But the most impactful time is that first 6 months. We would love to see you start doing that then, and then you'll have a really a more well balanced recovery.
And can you walk us through a little bit of how you can massage the scar or other techniques that you can use
Yeah.
to help there?
Absolutely. So early on, we're not touching the scar. Obviously, it's doing its thing, it's healing. We don't want to give it an infection. So we want to work kind of around that scar, just some light touches. I like to use different tools. So things like a really soft washcloth, just to bring some stimulation to that area to wake up those nerves that may be, a little damaged or a little um, traumatized from what we've gone through. And then we kind of work our way up from there as we heal. So whatever that time frame for you might be, and we start to get a little closer to it. Again, getting a little bit deeper with our touches. One of my favorite and most easy ways to get into this scar tissue, if it's healed, is to just kind of grab that scar with your fingers and pick it up and kind of just give it a little like pull and then move down the scar the whole way, little inch by inch, little pull, little pull, little pull. Because what ideally we want to see happen is if you think about the skin on the back of your hand and you put your finger on it, it glides across itself, right? And we want that scar tissue to glide just like the back of our hand skin does. We don't want it to be sticky. We shouldn't see puckering. We don't want it to be so tight where we're creating that C-section shelf. That's indicative that it's too tight. Our tissues are too tight and it's affecting our internal tissues and muscles and all the things, our internal organs are being affected by it. So we want it to glide, we want it to move. So once we get through that like picking up phase, we can really start getting in there. We want to get deep into the next layers. So that tissue layer where we have muscle and the linea alba, that, and then eventually we want to be able to get deep enough where we're touching internal organs, essentially, just helping them move and glide. And it's really deep. It feels a little pressure-y, but it's important and it needs to be done. You can also go to a pelvic floor PT, and a lot of them will do this. And there are practitioners specifically that do this type of work as well.
Well, but this is something that somebody can easily do at home when they want to, and go
Absolutely.
see someone at the same time, because then you can get more
Yes.
tips and tricks there. And is it
Absolutely.
something that they should be doing repetitively throughout the week, like something every day, or do they take rest days?
I would say 3 to 7 days a week, really, especially in those early days. I think more more days is better. I would say like even just 5 minutes a day while you're laying in bed in the morning or while you're standing in the shower. these are great things to do. And also varying your positions while you're doing it. Like I said, so we're laying down, we're standing up. So if you're sitting watching TV, it's great to do this in different positions and just get into those different formations and of the muscles.
And what are you doing when you are doing that? Is the main goal to get it to slide across, or is there other things that's the primary goal there?
That is the big goal. We want it to be able to glide. We want it to be unstuck, if you will.
And is there other different things that you can do to help your scar as well? Like breathing into the scar was a practice that we had mentioned, and would you be able to go through that?
Absolutely. This is a huge one, especially if you just, I mean, you're fresh, you could still be sitting in your hospital bed. This is a great one to do because it's kind of that internal massage for that scar. And like we've mentioned at the top of this, we want that scar to move. We want to be able to move our body. And I know when I say move your body, we're thinking like exercise or going for a walk or a run or whatever, but just breathing into that scar is moving your body. So if I'll walk you guys through this right now. So if we place our hands where we would see that C-section scar, I kind of call this our pockets, if you will, when I'm talking to clients. So if we put our hands in our pockets, we want to take a big breath and send our breath all the way down into those pocket areas. So you should feel that low belly expand on your inhale. And then as you exhale, it should contract away from your hands. Yeah. And so that's it. It's that simple. That's like the starting block. So, so easy. And yet we're not told to do that. Our doctors and nurses are not telling us that that's something that we can and should be doing. Even a full Kegel. I know a lot of people do Kegels wrong, but just that breathing in conjunction with a Kegel is so great for just activating those muscles in that area and bringing blood flow to there and helping us heal.
Yes, and Kegels mentioning that about people doing it not correctly. I feel like I see Kegels everywhere. It's all over social media. And can you touch on that? Because I do think that is a big thing that we should be talking about. If it like kind of like the no-nos or common mistakes that people can avoid when first getting into it.
Yeah, Kegels are they're not for everybody. And like I mentioned too, when we have a C-section, we are more inclined to being tight in our pelvic floor muscles. So really for us, what a Kegel should focus on is actually the release of the Kegel. So almost like a reverse Kegel, because basically what a Kegel should do is contract and lift up all of these muscles. So all the pelvic floor muscles, our core muscles should all be involved in this. Our diaphragm lifts up on that exhale. Everything lifts. On the inhale, everything should relax and lengthen out. So, really, for women who are more inclined to be tight, C section moms, we want to focus on that exhale to relax and let everything kind of just calm down, lengthen back out. Really, really important.
Okay, good to know. And that these are all things that you can easily reach out to someone like you or in these positions in their own hometown because this is a type of health that I feel like is kind of in the shadows a little bit. Like it's very specific but yet very needed. As you know,
Yes.
birth is very part of our life and this is something that really should be talked about not in a fear-mongered type of way.
Absolutely. Absolutely. I think the more empowered we are, the more easily we will kind of process all of this that has happened in our bodies and yeah, and just enable us to have these better birth experiences, really. Like we've gotten so into that state of fear that we've kind of lost touch with our own bodies and the processes that it can go through safely.
And I think that there is still data to be shown. And even what you mentioned about the obesity things of being linked, there's still some things that maybe we haven't learned about it yet. So it really is just this ever ongoing conversation of like, what is it? Is like, yes, is it necessary in some cases for sure, but is it necessary all the time? And where is it coming from? So I'm very glad that you came on the show. And is there any other things that you'd like to mention about C section specifically, though?
I just want to touch back on VBACs here. So I think that's a huge thing. If you've had a C-section and you are planning another pregnancy, and if you're hoping for a VBAC, I think it's really important that we are very candid with our care providers, and choosing one who will empower you and promote that with you if that's what you're going for, because not all of them do, as we kind of know. And maybe looking at changing care providers. I know I changed care providers from the time I had my first to the time I had my second, just for because I moved out of the city. But really, I think it's important to kind of do your homework there and maybe ask around. Even there's so many wonderful mom groups online anymore in our areas, and just asking around who has had one and who would you recommend to do that type of work? Who have you had a great experience with? Because we know it's a better outcome, it seems, when we have a vaginal birth.
Well, I think that when it comes to it, it's just one of those. It might seem quick and it might be easy. I guess the quote here quotes quick and easy for you, but that's not like as most things that we know. There's really no quick or easy ways without something down the line getting a little bit more complicated. And this is very much one of them. And I think when it comes to C sections, I do classify it under the sexual wellness sabotage categories that I do here because it is
Absolutely.
like it is promoted out there like this is a safe, effective, like nothing's going to go wrong, you're totally okay, blah blah blah. But really on the flip side of it, I do feel like 18 months is a long time to heal. I don't think that a lot of people know that. I do think that there is a lot of like bonding issues, I think, that come up that people don't know, and then it brings on guilt and it brings on shame, and these are not things that you should be, these are not burdens that you should have. This is not your fault, that you didn't know this.
Yeah, absolutely. I think we've come a long way since I've had my C-section, but I think we still have so much work to do. It's really welcome to see that we're kind of changing that narrative, but again, there's a lot to unpack and uncover still. I think, especially seeing these rates climbing the way that they are, I think we have to do a better job of informing women what the real complications are, what to actually look for, because like I mentioned, the misconceptions, like especially the sexual well-being is pertaining to like your audience. I think we think that it's keeping everything tight down there, which is not ideal. We don't want it to be tight down there because that is a sexual sabotage. Ask me how I know. Gosh, I went almost a decade in a sexless marriage because I just couldn't. I could not. It hurt so bad. We literally only had sex to make babies, and it was awful. So I wish I had known that.
Well, that's the thing, the pain there, because I know that bladder leaks, there's a lot that I hear about when it comes to that after, but we don't touch on the pain of after C-sections. And again, it's that like, oh, you're no infection, you're good to go. But that pain, and it can hurt relationships and it can hurt marriages. And it again, it's like it's not you. It's not what happened. Like, it's not you who's doing this. It's kind of like a side effect to what went on. And
Yeah.
even with that pain, it can stem, from my understanding, like all over the place, like not necessarily just in that one area.
Absolutely. Because our whole body is connected by fascial lines. If there's tension in that scar line, we see a lot of prevalence of women having migraines after they've had a C-section, and that's directly correlated to the tension that's in our tissues. It's now like driving through our whole body, or TMJ pain, jaw clenching. That's another big one that people don't correlate to having that C-section. But again, the tension in the tissues, it's going to show up elsewhere. It's not just one spot.
And can you go into a little bit more of the pain of like what might be? I've heard certain ones where a woman might start to like lean forward and like her back might start to arch because it gets really tight there afterwards. And so the ability to stand up straight actually hinders them a little bit.
Yes, absolutely. Oof, that's like again why scar tissue massage is so important. That tension in that scar line can really do a big number on you. I had lower back pain for so long. I thought something was wrong with me. And it was
Mm.
because I just didn't have the strength in my core to support my body anymore. And again, it comes down to that tension in that scar line, just pulling me, like you said, forward. So it's just everything was elongated out in my back, but my abs were very, very tight and immobile. And so it was causing a lot of issues. And we see a lot of that just pain because we can't connect to those low abs anymore because the scar tissue just adhering there. So they're not able to open the way that they should and contract the way that we need them to.
So if you get disconnected from your lower abs, is that something that's like ongoing, or are there exercises later down the road after you've healed you can come back to and work on that?
Even before you're healed, you can start. Yeah, just something simple as, you're laying in your bed and just pulling one foot up towards your bum, just laying there, just little gentle heel slides. Something like that is activating those low abs. Again, we want to do that with that connected breath. That's really, really important. So we're activating those muscles properly, but it doesn't need to be like powerlifting or anything crazy. It's just really gentle movements. As long as we're taking the time to focus in and moving with intention, that's really fundamentally important to reconnect to those low abs.
Wonderful, wonderful. Well, thank you again for coming on the show. And where can my listeners find you?
Yeah, absolutely. You can find me on Instagram. It's Jennifer Sharp with a little underscore. Other than that, I'm also on Facebook, Jennifer Sharp Fitness. You can find me there, pregnancy and postpartum. Do in-person programming and virtual programming as well.
Wonderful. So I will make sure to put all of your programs and all of your courses in the links so people can reach out to you and get more information on this. But thank you again for coming on the show. And for my listeners, you guys know what to do. As always, stay kinky.